Statement. Mr. Burgess.
Thank you, Mr. Chairman. I want to thank you and our witnesses who are here with us today for participating in this very important hearing, because once again, as you've already articulated, we find ourselves in the middle of a foodborne illness outbreak, this time involving the safety of a food item that we frequently buy, eat, and serve to our families. Just this morning, I viewed pictures taken by the Food and Drug Administration at both companies' egg production facilities during the FDA inspections. These photos document some extremely unsanitary and unsightly conditions, including piles of chicken manure that was pushed up against an open doorway and leaking outside a laying house, dead flies by the thousands, rodent holes, structural damage to buildings, and chicken carcasses. Now, these companies must be able to account for and respond to these photos, and I'm also anxious to ask the Food and Drug Administration if the public can take comfort in the fact that these observations are not normal. I wonder if the FDA will be able to answer this question, considering that they have not inspected any other egg production facilities besides these two in quite some time. To date, the Centers for Disease Control has reported that over 1,500 illnesses are likely to be associated with salmonella in eggs. I want to thank our first panel of witnesses, both victims of this outbreak, for appearing today to share your stories. The outbreak of salmonella in eggs is unique in that the salmonella contamination is not from the shell, but from the interior of the egg. Test results indicate that the laying hens themselves were infected with salmonella, and the hens passed the contamination through the inside of the eggs. One very important fact about the investigation, perhaps an indication that this hearing is held before we have all the facts, is that the ultimate source of the salmonella contamination is not yet certain. Concerns about the feed given to the young chickens and the unsanitary conditions at the suspect farms have been raised. I hope that the testimony provided today will move us closer to understanding the original source of the contamination and how to prevent it from ever happening again. By early August, the traceback investigations completed by the CDC, the FDA, and the state partners indicated a common source of contamination from a single farm owned by the DeCoster family. On August 13, Wright County Egg issued a voluntary recall of approximately 380 million, and on August 19, Hill and Dale, owned by Mr. Orlando Bethel, issued a voluntary recall of eggs after being suspected as a potential source of contamination. Responsible corporate actors are crucial in maintaining a safe and reliable food industry. Companies must observe good manufacturing agricultural practices. The documents and subsequent photographs obtained by this committee raise serious questions about whether both of these companies were consistently maintaining such good practices. Of particular interest are the documents that show the test results done on behalf of DeCoster Farms in 2008 through 2010. The occurrence of salmonella-positive environmental samples is frequent. 72 of environmental sponges were tested for salmonella, and only 8 were negative. Experts who have spoken to staff have indicated that environmental samples that turn up positive for salmonella may be expected on a farm and do not necessarily indicate that the food end product is contaminated. But I want to know if these findings warrant cause for alarm and become troublesome, if positive results become a pattern and are not rectified. I want to ask the DeCosters about these tests and what the company gleaned from this information, and I'm also interested in what the FDA has to say about this as well. Other documents obtained by the committee include numerous sanitation reports completed by the Department of Agriculture and Marketing Services, some of the hazard plans, unsatisfactory sanitary conditions, an array of observations at Wright County Egg over a 4-year period of time. I would like Mr. DeCoster to comment and explain these records. Although the Food and Drug Administration has told my staff that the eggs have historically been considered a high-risk food product, the FDA did not inspect these egg facilities prior to the outbreak. During the inspections discussed in the FDA Form 483, the investigators noted that each company failed to fully implement and follow procedures in their salmonella prevention plans, and now we have the pictures to document that failing. Tests conducted in August by FDA investigators at Wright County Egg were positive for the same and other strains of salmonella. These samples were taken from manure pits, walkways, chicken feeds, and other surfaces. I want an up-to-date report from the companies and the FDA explaining where the exact matches of salmonella to the outbreak strain that caused human illnesses were found, and how the companies and the Food and Drug Administration interpret these results. It is important for the FDA as well as the industry to work cooperatively internally with other federal agencies and with health and agricultural departments to reduce the number of and help prevent foodborne illness. A new egg rule became effective this July that addressed several of these concerns associated with eggs involved in this outbreak. However, it took the Food and Drug Administration over 10 years to act on this issue, illustrating the continued systemic, problematic, and bureaucratic weaknesses that plague the Food and Drug Administration. The future FDA should not be a reactive body. It should be proactive. Mr. Chairman, I support conducting this investigation and holding a hearing. I'm concerned that we're not always done in a most bipartisan and useful manner. September 9, I sent a letter to you stating that I thought the CEO of the FDA, the Commissioner of the FDA, Dr. Margaret Hamburg, should be here to offer the agency's official testimony. She and the Obama administration have repeatedly stated publicly that food safety and the resources of the FDA is a top priority and must be taken seriously, quickly addressed. In the 110th Congress, Commissioner Andrew von Essenbach was here 4 times and testified on food safety. The majority declined to invite a representative from the United States Department of Agriculture to testify, even though the committee sent a document request to the agency, held a briefing, and received thousands of pages of relevant information concerning their role in the regulation of these farms and this outbreak. Staff has obtained and reviewed relevant, revealing USDA documents, including USDA shell egg plant system, audit reports, preoperative sanitation reports, and a USDA inspector notes and observations from Wright County Egg. This hearing would be more productive if a USDA official were here to answer questions related to these documents and perhaps answer the #1 question, why didn't you say anything to the Food and Drug Administration? The ultimate goals of this hearing are good, and I support the food safety legislation that this House has passed in 2009. I'm eager for the Senate to move on this important issue. Mr. Chairman, I thank you for your forbearance, and I'll yield back the balance of my time.
Gentleman's time has expired. Mr.